Good evening, everyone. Today we are going to discuss another set of one-liners in relation to our pediatrics. To start with, APLA syndrome, antiphospholipid antibody syndrome. What treatment should be given to the pregnant female to prevent abortion? Is it IVIG? Is it plasmapheresis? Is it aspirin or low molecular weight heparin or methylprednisolone? What is your answer? The answer is aspirin and low molecular weight heparin. Something about your antiphospholipid antibody syndrome. As you know, it is one of the autoimmune multisystem disorder. It is characterized by arterial, venous and small vessel thromboembolic events. We can get DVT, we can get thrombocytopenia, livedo reticularis, stroke-like manifestation, and most importantly, repeated fetal loss, transient ischemic attacks. These are the findings we can get. For diagnosis, we can get either anti-cardiolipin antibody, anti-beta-2 glycoprotein 1 antibody, or lipase anticoagulants. So the synonym is Hughes syndrome. Diagnosis required. What is required for the diagnosis? A patient should have both a clinical event and antibody. Clinical event in forms of thrombosis or pregnancy morbidity like your repeated fetal loss. And the persistence presence of antiphospholipid antibody. How to document? It is for that we have to detect anti-cardiolipin or anti-beta-2 glycoprotein antibody, a coagulation assay, that is your lipase anticoagulant test, or both. These are the findings, both clinical and lab wise. We have to get our requirement for to tell that this is a case of antiphospholipid antibody syndrome. Then only we can treat with aspirin plus low molecular weight heparin. Next, thalassemia occurs due to which mutation? Is it missense mutation? It is transition, splicing, or frame shift mutation? Just MCQ purpose, we can know the answer is frame shift mutation. Next, which one is not true about Aicardi syndrome? Aicardi syndrome, we know among these four, one is not true. What could be the answer? It affects both girls and boys. Retinal lacunae is seen. Unilateral hips arrhythmia initially can be seen in EEG or characterized by both corpus callosal agenesis. The answer is it affects only the girls. So both boys and girls is the wrong answer. It is a rare X-linked disorder. The fetal loss will be there in case of male. So only girls they do survive. The triad of Aicardi syndrome, we can say infantile spasm, corpus callosal dysgenesis, and chorioretinal lacunae. This is the triad. And the key is, think of this syndrome when evaluating a female child with infantile spasm and multiple CNS malformation in form of your agenesis of corpus callosum, gray matter heterotropia, posterior fossa abnormality, polymicrogyria, and intracranial cyst. In many of the malformation, CNS malformation we can get. So any CNS malformation in a girl child with infantile spasm, we have to suspect Aicardi syndrome. Or easy to remember, this is most commonly Aicardi syndrome is corpus callosal agenesis. The one thing to remember, it affects only the girls. Next, Thomson liver is seen in. We know Thomson scoring, we know Thomson liver. Thomson's liver is seen in your scarlet fever. And Thomson scoring, we are using it HIE. Next, blue diaper syndrome is seen in which condition? Blue diaper syndrome, the answer is indicanuria or Drummond syndrome. So blue diaper syndrome, or what we'll get in that, the defect is in basolateral tryptophan transporter. As you know, tryptophan enters the intestine, it is reabsorbed or is converted to indole by bacteria and lives in the feces. So any intestinal disorder and in heart nerve disease that causes increased tryptophan conversion to indole. This increased indole get reabsorbed, it is excreted by kidney, and on exposure to air, it turns out to be indigo blue. So your blue diaper syndrome is seen in indicanuria, or it is known as Drummond syndrome. Next, which drug can cause blue man syndrome? If you will give this drug, then there will be formation of blue man syndrome. What is the, we know the answer is amiodarone. Something we know about gray baby syndrome, we know about bronze baby syndrome, red man syndrome, and another is blue man syndrome. So gray baby syndrome, it is found in chloramphenicol poisoning. Chloramphenicol can cause gray baby syndrome. Bronze baby syndrome, in which condition will get? If you will give phototherapy, conjugated hypervolemia, there we can get bronze baby syndrome. Red man syndrome, it is related to your vancomycin. Similarly, blue man syndrome, they have written in chronic amiodarone intoxication, we can get in adults, we can get blue man syndrome. Blue baby syndrome, we can see in many conditions like your cyanotic heart disease, your cyanotic heart disease, and many conditions where you can get blue man syndrome. But in case of adults, the classical finding is your amiodarone that can cause blue man syndrome. Next, serological testing of choice for celiac disease for a child of less than 2 years. So which investigation among these four, which is the serological investigation of choice? Is it anti-TTG antibody, or it is anti-endomycin antibody, or anti-deaminated gliadin peptide antibody, or HLA-DQ2, DQ8? Which one is the serological test of choice less than 2 years? The one thing to remember, less than 2 years, if you are suspecting celiac disease, the serological test of choice is your anti-DGP antibody, that is anti-deaminated gliadin peptide antibody. Which view of heart do leads V1 and V2 represent? We know there are various leads, V1, V2, starting V3, V4, V5, 6, AV1, ABL, AVF, like that. So which view of a heart will get this V1 and V2? That represents which view? Is it inferior view, anterior view, lateral view, or septal view? The answer is septal. To know inferior view, the leads are 2, 3, and AVF. Lateral view, lead 1, ABL, and B5, B6. Anterior view, B3 and B4, and septal view, B1 and B2. We have to remember, we can get one MCQ in exam. So septal view represent your B1, B2. Anterior, B3, B4. Lateral, lead 1, ABL, B5, B6. Similarly, inferior, 2, 3, and AVF. All of the following are neural tube defects, except among these four, one is not coming under the term neural tube defects. Is it meningomycin, anencephaly, encephalocele, or holoprosencephaly? The answer is holoprosencephaly. That is not coming under neural tube defects. Holoprosencephaly, this is a cephalic disorder in which the prosencephalon, that is a forebrain, fails to develop in two hemispheres. These are the classical clinical findings what we can get in holoprosencephaly. The upper prosencephalon, that is your forebrain, that is fails to deploy between the two hemispheres, and that is known as your holoprosencephaly. That is a separate entity that is not coming under your neural tube defects. Next, Christmas tree cataract is seen in which condition? The answer is myotonic dystrophy. Something about related to Christmas tree rash we can get in pityriasis rosea. Christmas tree bladder we can get in cystographic appearance of neurogenic bladder, we can get Christmas tree bladder. Similarly, Christmas tree appearance of the polyp, we can get the histological finding in Pew-Jagger syndrome. The upper one, the first one, upper one is your Christmas tree cataract, which we are getting in Christmas tree cataract, which we are getting in myotonic dystrophy. Second one is your Christmas tree, your cystographic finding in case of a neurogenic bladder, that is Christmas tree bladder. Third one below, that is that we can get in pityriasis rosea, the Christmas tree rash, and fourth one is your Pew-Jagger syndrome, where you can get Christmas histological finding like this Christmas tree appearance. So this is for your quick revision, some MCQs. Please like this video, share this video, and subscribe to my channel. Thank you.